I'm Dr. Jeremy Suess. I'm from Clackamas Smiles. We get a lot of questions about Invisalign and clear aligners and how to move teeth in orthodontics. And one of the biggest ones is, what is Invisalign, or what are the other brands out there? And right now there's a lot of brands on the market. So it's kind of like Coke or Pepsi. Invisalign is just a specific brand name for clear aligners. Now, what clear aligners do are move the position of the teeth. If they're crooked, it gets them straight. If they're tipped, it can untip them. So it takes something that's not in the right place and it helps move them in the right place. We practice two kinds of orthodontics here. Some are clear aligners and the other are traditional band and bracket, the metal braces that you're used to. So we get a lot of questions from parents, from concerned adults, and they're like, do they look different? Well, of course they look different. The clear ones are clear, you can barely see them, and they're called invisible for a reason. They're hard to see. Now the metal ones, although they can take longer, they can do movements that the clear ones aren't quite so good at. So when we get the question from a particular patient, can I have the clear ones? Do I need the metal ones? The answer is, it depends on the kind of your teeth, how long you want it to take, what you want it to look like. And sometimes if you're okay with a couple compromises, the clear ones are perfectly fine. But if you're a perfectionist, sometimes metal is still the way to go. Is Invisalign faster than traditional braces? And the answer, in about 80% of cases, it is. The cases where we can go off track is if there's complex movements or if there's really severe change to the teeth that we want. We can actually be a little bit faster with metal ones, but for 80% of our patients, the clear aligners are really the way to go. We get asked a lot, what's more comfortable? Traditional braces, clear aligners? Without a doubt, we can tell you that the clear aligners are way more comfortable. When you can take them out when you eat, when you can take them out when you brush, it just makes life almost normal again. And that's fantastic. When you have the metal braces in there, they're always in there. That's just how they work. And you have to clean around them, you have to eat around them, food gets stuck in them. Doesn't mean they're bad, but if you want to be comfortable, clear aligners is the way to go. When I get asked how long will clear aligners or Invisalign take to straighten their teeth, the answer is it depends. How far do you want your teeth to move? How bad were they? For a lot of our patients who've had braces before and you have relapse, you lost or broke your retainer, that fix can actually be really rapid, sometimes as low as 6 months. However, if you have a long way to go and a big disagreement between your teeth, that can take a lot longer. So it depends on how far you want your teeth to move and what results you want at the end. When I get asked about doing your own braces or doing your own aligners, I'll typically tell the patient that last time I tried to fix my own car, it didn't go so well. I tried to paint my own house and it just wasn't fun. I didn't get the results that I wanted and I messed some stuff up along the way. Now, if it's your car or your house, those are replaceable. But if you mess up a tooth, if you mess up the gums, if you break something in the mouth, that can't always be fixed. So you need to be really careful when you're gonna say, hey, I'm gonna do my own treatment, or I'm gonna let a computer do my treatment, or someone that I've never met. That's my caution there. You don't wanna end up with a result that's gonna be bad for you or your teeth. As a word of caution for online dentistry or self-directed aligners, we really have seen some damage done to teeth, and that comes with moving the teeth outside of the bone. It comes with moving the teeth past the confines of the gums. If you get that recession, if you get that loss of foundation, we can't always get that back. So that's something that everybody should be aware of. When I get asked if braces or aligners, clear aligners like Invisalign, if that's painful, what I can say is there's absolutely discomfort. Just like when you start working out, you're stretching muscles that haven't been used in a long time. And I know teeth aren't muscles, but when you move the teeth, you get that same kind of soreness. Now, after the first couple days, the patients say that really melts away and they get really used to their aligners. And when you change to a new one, it's tighter and you're like, I remember that feeling again, but you know what, that passes really quickly and the teeth really do speed up. So it's a momentum thing, but if you're okay with a little discomfort, you're gonna get through it just fine. We love getting the question, will my dental insurance pay for my Invisalign or clear aligners? And the answer is, if you have an insurance policy with that as a benefit in it, they're gonna pay for your Invisalign almost just as well as they'd pay for traditional braces. So I've met plenty of adults and tons of children who have wonderful coverage for their ortho, whether it's a clear aligner or a traditional band and bracket, a regular wire case. And the answer is, give us a call, we're happy to look it up. That's something we can find really easy. Well, I hope I've been able to answer some of your questions about clear aligners and orthodontics. If you have any questions in the future, if you want to see if you're a candidate, or you just generally wanted to see if your teeth needed any additional help in that regard, feel free to give us a call at the office, 503-786-3000.